Welcome, and thank you so much for the invitation to join you today. I have the pleasure and privilege to chat with you today about access to care, challenges, and resources. So, first, a little bit about NORD. The National Organization for Rare Disorders was founded in 1983 by an ad hoc coalition of advocates. Really, they were families, parents of rare individuals. And this group of advocates was instrumental in the passage of the Orphan Drug Act. You may or you may not know, but the Orphan Drug Act turned 40 this year. So too did NORD. Coincidence? No. And this group of families realized that even with the passage of the Orphan Drug Act, there was so much more to do. So prior to the passage of the Orphan Drug Act, there were only 10 treatments that had been developed for rare disorders. We've come a long way. Since then, the rare disease community has seen a number of additional treatments. The narcolepsy community is one of the 5% of rare diagnoses that actually have a treatment. But there's still more work to be done. At NORD, we believe that all people living with a rare disease have a fundamental right to their best health and well-being. And with that belief as our guide, we advocate for solutions that address their complex issues and needs. So let's talk a little bit about access. Access refers to the availability of health care and the ability of individuals to access that care and treatment. Access is integral to health and well-being. So what are some of the challenges of living with a rare diagnosis? Well, many of these you all have experienced. It takes an average of 5 to 7 years for an accurate diagnosis. There are few medical experts. There's little research, small scattered populations, social isolation, extensive lifelong medical needs, and over 90% of rare diagnoses do not have an FDA-approved treatment or therapy. When there is an FDA-approved treatment or therapy, that high cost of care and treatment often plagues the community. How does NORD support the rare disease community? We do that through our work in policy and advocacy. We have a dedicated team down in Washington, D.C. that works not only on that national level, but we also have individuals who work on the state level. We look at legislation, we look at grassroots initiatives, we look at rare disease advisory councils, things, and we look at what's happening in the landscape of healthcare that will impact our rare disease community. We support the community through research. We have research grants for translational and clinical studies. We have our I Am Rare registry platform and natural history studies. And we support original research and publications. Patient services and information services. Alicia and I will talk a little bit more about that. But we talk about patient assistance programs, access to clinical trials, travel and lodging support, emergency relief programs, innovative programs that are responsive not only to quantity of life and access to healthcare, but quality of life concerns as well. And education. Some of you may know we just are off our Living Rare, Living Strong Patient and Family Forum. This was in Washington, D.C. It was also a celebration of our 40th anniversary and Rare Impact Awards. So we try to provide education that is actionable and usable and responsive to the rare disease community. Our patient services team, we have a dedicated team that all we do is service patients, respond to patients, support patients. We have a communication center that is staffed Monday through Thursday, 8:30 a.m. to 7 o'clock p.m., and Friday, 8:30 a.m. to 6 o'clock p.m. Eastern Time. We're available through our website, rarediseases.org, and we have email addresses and dedicated phone lines for our narcolepsy and our disease state specific programs. You can access those through our website, rarediseases.org. Alicia, let me turn it over to you to talk about information and resource services.
Thanks, Jill, and thank you again, everyone. Hello. As noted, my name is Alicia Lawrence, and I'm the Information and Resource Services Manager. When our team receives inquiries that we may not have a disease state patient assistance program for, my team assists with finding other potential resources that may be able to assist the caller. We can be reached via email or phone, and our hours are the same as patient services, so we're available to help when needed. Some of the inquiries that we do um, have help with are newly diagnosed patients, financial assistance, and like I said, with those both medical and non-medical needs, we are able to provide other resources and supportive resources. It could be wanting to be in touch with others that have the same disease state, and you may be looking for support or counseling. Next slide, please. As noted, we do receive lots of inquiries, and one of them are, patients wanting to be able to be in touch with others. And NORD, we have a motto that is alone we are rare, together we are strong. Our host today, Wake Up Narcolepsy, is a great resource for the narcolepsy community, along with Narcolepsy Network, and they can provide answers to questions that you may have related to narcolepsy directly, along with your providers. We also suggest speaking to your providers. Next slide, please. As stated earlier, we do get inquiries related to support, and Wake Up Narcolepsy has a free online support that meets regularly, and there are different types of topics discussed. If an online group is not something that you're interested in and want more individual support, you should speak with your provider to request a referral for counseling, or you can contact your insurance provider to find out if there are any providers in your area that will provide counseling services for you. Next slide. We do get calls related to disability questions, and with that, there are a few requests that happen. Some calls are related to being discriminated at work, and with that, the ADA, which is the American Disability Association, is a good resource. They have information regarding disability laws, advocacy, and other topics of interest. We actually received a call not too long ago about an individual who wanted to continue working but was concerned about how her employer would be able to will take being diagnosed with a rare disease. We referred her to the Job Action Network. This, along with the ADA, has information on your rights and how to disclose your disability. They also have useful toolkits that are very helpful as well. For some, working has been a challenge and they found that they're not able to work. If this is the case for you, Social Security may be an option. They also provide a nice checklist to make sure that you have the information necessary in order to apply for Social Security. And I just want to remind you that it is a process, so it does take some time if this is something that you're considering to do. Next slide. Insurance. Navigating insurance can be a very overwhelming situation. And so some of the questions that we do get is, why didn't my insurance cover my prescription? Why am I being rejected for insurance claims or prescription or treatment? And what do I need to do in order to get prior authorization? The most common reason why treatments and prescriptions do not get covered by the insurance company is because the insurance company has determined that the medicine or procedure was outside the list of items that they agreed to cover. This list is referred to as an individualized formulary, and these formularies can include lots of providers, pharmacies, medication, treatments, and healthcare networks that will offer coverage for anything. And the things that are not covered on the list are the ones that you should be concerned about. It is important to check with your insurance provider to just make sure that whether it's a treatment or prescription, that it will be covered. This can hopefully stop the denial of the claim. Your physician may have prescribed a medication or a treatment that the insurance company believes is not appropriate for your care. In this event, you may want your physician to contact the insurance company to begin a process called prior authorization so that they can appeal the treatment coverage, the appeal for the treatment coverage. Your physician may also have prescribed a medication or treatment that is considered brand name, and your insurance company may decide that they want you to go with a generic version. For this, most insurance companies will want you to undergo something called step therapy. Step therapy is when the insurance company recommends a lower cost medication to treat you instead of the one the doctor prescribed. If the doctor wishes to go through the original prescription, they will need to defend their decision with the insurance company and hopes that it gets covered. It's important to know that you have the right to call the insurance company and find out why they are denying your claim. That is your right as a patient. And with that, some if you know ahead of time that your medication is going to need prior authorization, there are a few things that you can do just to prepare yourself. Insurance companies are not very familiar with rare diseases. And so it's important to educate them that, this is a rare disease and that, the coverage is needed in order for you to, have a quality of life. In order to help that, it's best to inform them of your condition to better understand your treatment options. You can be sure to give them some information. If you know the ID code for the coding system, you can let them know that, and you can also get that information from your provider. Also, make sure that your provider, your pharmacy, and medications that you are taking are in network to not have any of this happen to you in the future. If you are unsure about certain treatments, providers, or medication will be covered, request that your insurance company performs what's called a test claim, where they can pretend to do a dummy claim, for lack of a better word, to make sure it's covered. So, with all of this said and done, you're finding that you're still being denied claims and your claim is still being denied. You can, as a patient, have the right to do what's called an internal review or appeal. You have that right where your provider will be able to contact the insurance company to explain why the decision was had. You can also do a peer-to-peer review with an expert in this specialty, and your provider hopefully will be willing to assist with that. I know this was a lot of information, and we will at the end have some resources that we'll be sending out for you to reference if needed. Next slide, please. Self-advocacy. Let's start with the definition. An individual's ability to effectively communicate, convey, negotiate, or assert their own desires, rights, and needs. Knowing what kind of support is available to you is helpful and important. Consider Wake Up Narcolepsy as well as other resources to help, such as the brown bag webinars that we have here. There's also accommodations for school and work that are helpful on the Wake Up Narcolepsy website. Also on the Narcolepsy network, they also have tools for students when you're in school. That seems to be, we get a lot of inquiries related to what to do when a child is in school as it relates to accommodations. And so there are resources that you can use to help to guide you through that process, along with contacting patient advocacy organizations, disease-specific patient advocacy organizations. Communicating with others is also something that you should consider. And Project Sleep actually has a nice toolkit that helps to guide you in how to communicate the support that you need with your providers, as well as even some family members. And so some of those things will be also in our resource list at the end. Next slide. Although self-advocacy is important, sometimes you may need some guidance with just other information that you may not know yourself. And so you have the patient advocacy organizations such as NORD and our information and resource services team. We are able to provide resources and support you in any way that we can, but also disease advocacy organizations such as Wake Up Narcolepsy and Project Sleep. I know that, again, this was a lot of information, but be sure that we will have this information for you to reference. And thank you again.
So let's talk a little bit about what comes next. What's the future of rare? Well, improved diagnostics and reduced time to diagnosis, newborn screening initiatives, new research and new treatments, Nord Rare Disease Centers of Excellence. Again, another coincidence, but we're celebrating our 40th anniversary, and we just named our 40th Nord Rare Disease Center of Excellence, so that there are centers of excellence for rare diseases around the country. We have state rare disease advisory councils, and more advisory councils are being passed and approved every month or so. So we are hopeful that all 50 states will have a rare disease advisory council, perhaps by the end of this year. That might be a little bit optimistic. But the future of rare is, in fact, optimistic. We are seeing more treatments. We are seeing better access to treatment. And so Alicia talked about advocacy, and she talked about advocating for yourself and using the resources that are available to you. There are more out there, more being developed every day. If you need assistance, ask for it. So, with that, we'll take questions that you may have. And as Alicia mentioned, we will prepare a resource list. We've actually got it most of the way done. We wanted to see if there was any additional resources that might need to be added after we received your questions today, but we promised to make that available to Monica and Tammy at Wake Up Narcolepsy, and they'll send that out to the folks who have registered for this program. So with that, I thank you.
Jill and Alicia, thanks very much, very much. So we do have some questions. Is there one place you'd recommend for resources and information about rare diseases?
Rarediseases.org is a really good place to start. That's NORD's website. And we really do have a plethora of resources. We've just relaunched the website, so it is much more user-friendly than you may have found in the past. If all else fails, there's a search bar up in the top right of the screen, so you can go in and you can search for your disease state. You can search for the most recent rare disease report on narcolepsy or in any other rare disease with which you may be diagnosed or maybe seeking information. There are resources not only for patients, but for caregivers, resources for healthcare providers. There are webinars, information about clinical trials. That really is a great starting place.
Excellent, thank you. Does narcolepsy meet the level being considered to be considered a disability, and what are the steps to qualify and apply for a disability?
So narcolepsy, Social Security has a list of diagnoses that they're considered to be, you know, qualify you for Social Security benefits. Narcolepsy is not one of them. However, Social Security does provide a nice kit, and I will put that in. That's one of the resources, actually. There are steps. The first step is that your provider has to write a letter stating that narcolepsy is not allowing you to work, or you're not able to work, or it is interfering with you being able to provide yourself an income. There's so there is a step. That's the first thing you have to do, is be qualified for Social Security. Again, it is a process, and so it's not something that can happen in a month. It can take a long time, because there are individuals who have been able to make a living and be productive with narcolepsy. And so again, it's educating, whoever you're speaking to, and this also falls into self-advocacy, having the right information in order to present this information to Social Security. But the first step is to get the information from your doctor. Then once you get the information from your doctor, you can also call Social Security. They will tell you the numbers. I'll put the number in the resources, but you can call Social Security. They will tell you what you need to do to initiate an application. You can actually start an application online, and then they would send you the information. But it's always good to be prepared, have your medical records in place, you know, medications. You may have to go in for a medical appointment. So it is, again, something that can be done, but it is a process.
It's
Thank
not
you.
one it's not one of those diagnoses that's immediately recognized by Social Security as being eligible for disability. So to Alicia's point, there is a process, but every individual is impacted differently. And so that demonstration of the inability to work, the documentation of that by your physician or healthcare provider really is going to be critically important. You'll need to advocate for yourself and follow the process, but it may be a prolonged one.
Mhm. Just out of curiosity, how long does it typically take for someone to be approved?
It can take months, it could take a couple of years.
Hmm.
And no matter when you're applying, as soon as you apply, let's just say you applied in a week and it does take 2 weeks, they do retro it back to the time of the application to sometimes. So you can get a lump sum, but it can take years, and sometimes you do get denied, and then someone will get denied, and then they would have to appeal again for the decision to be reviewed again, for the case to be reviewed again.
So it's not to say you shouldn't apply. It's not to say
Right,
you
it's
won't
not
be
discouraged.
eligible,
Yeah,
but we do want to set realistic
yeah.
expectations.
And to
Mhm.
Jill's point, every case is different. Some people can work part-time. Maybe they just can't work full-time, and so it's based on a case-by-case basis. It's not just one size fits all. So
Mhm. Okay.
I encourage anyone who feels that they are entitled to it to go for it.
Okay. Thank you. Question. So if we are able to access a PAP to help with prescriptions and we are uninsured, how do we pay for and access specialists and labs in the thousands? That must be cost in the thousands.
Sure. So patient assistance programs all have specific eligibility criteria. For some patient assistance programs, typically your premium and copay programs, an individual has to have health insurance, and then those copays or coinsurance costs that the PAP assists with cover copays and coinsurance for prescriptions, doctor visits, lab tests, diagnostics, sleep studies, things like that. For individuals who are uninsured, what I would encourage you to do is find a patient assistance program that can help you to get health insurance and cover your premiums. We find that individuals have better outcomes, better disease trajectories when they are insured. So I would encourage that path. In terms of finding patient assistance programs, there are a couple of things you can do. You can contact the manufacturer of your medication, and you can contact NORD. If NORD is not able to assist, we may be able to direct you to someone who can. If you're uninsured, you would not be eligible for a copay program because by definition, in order for it to be a copay, insurance has to be paying part of that, which is why I would direct you to try to find premium and copay assistance. NORD does have a program that covers that, and you can certainly reach out to
Mm.
our narcolepsy program.
Thank you, Jill. Any advice for dealing with insurance and appealing prescription decisions? I am working with my doctor and with the pharmaceutical manufacturer's patient program, but it's been more than 3 months trying to get a medicine I need that is only dispensed from one pharmacy in the country. Any additional tips I should be doing?
You're doing the right thing. Again, that is also a process. There are 3 tiers to appeals, and so it may be that you have to do the initial appeal, then go to the second appeal, and then go to the third appeal. And it can take a while. And so, it would just be important to stay on top of your provider. If you can, call the insurance company and find out exactly where what's the status of your appeal, and just be involved so that they can see that there is consistency, and maybe that would be helpful in the timing of the process. But it is a process that can take some time.
The other thing that I would suggest is the manufacturer of your medication may have what's called a free drug program, and those programs are for individuals who are uninsured or who have been denied coverage. And while you have insurance, you're going through that process of getting that approval. So
Mhm.
sometimes there's what's called a bridge program that can provide access to that medication until you get that approval. So I would contact the manufacturer of your medication because that's who would be administering that type of a program, and see if there is access to cover you in the interim.
Excellent, thank you. Do pregnant women on stimulants for narcolepsy get approved for disability typically?
That I'm not sure, only because that's a medical question. Jill, I'm not sure
Oh,
if you.
oh, so,
What I would say is that's something you're going to need to work with your physician about, because that disability may be related to the pregnancy as opposed to related to the narcolepsy. And so you're going to want to talk with your healthcare provider, and he or she is going to want to pursue the appropriate tact or track for that one. There's not a flat answer that we can
mhm.
give you for that.
Okay, she ended up adding another caveat to that, since the stimulants can't be taken during pregnancy.
Mm.
So I think go back to the provider and
Yeah.
discuss options. Okay. Let's see. Next would be, is there a type of doctor or someone who will oversee all of my medical care? I have so many complicated issues and nobody looks at everything as a whole. I'm bouncing from specialist to specialist and nobody knows what to do with the new diagnosis.
Yeah, that's a real challenge. And so what I would look for is a center of excellence that really coordinates care, or look for a care provider who probably is at an academic medical center. So that, again, you can coordinate all of those specialists. They call them medical homes. And so that you're not bouncing around, and that, let's say you have to go in for a sleep study. Maybe you also need a sonogram. They can schedule them sort of on the same day, so you're not bouncing the same way. Or if you need to have a follow-up appointment with this doctor, you may be able to schedule that doctor and your labs on the same day. So you want to look at coordination of care, and that typically you're going to find in what's called a medical home, or talk to one of our centers of excellence. If you're not able to access one of those, you really are probably best based out of an academic medical center where all of the specialists are at least going to be in the same vicinity.
Thank you. Next question. How can we access trials if a location is blackballing a participant? The participant was in a trial and a legal issue arose. The administrator is angry. They had to answer to the court and is punishing the participant who wasn't at fault. In talking with other participants, the same thing is happening to them without the same cause. How do we hold the admin responsible?
Interesting question. So, clinical trials um, typically answer to an IRB, an institutional review board. And the institutional review board sets up the criteria for eligibility and inclusion in the trial. So if you are sort of meeting a roadblock with a study sponsor or the study site, you may ask to speak with the IRB. There's not outside influence. It's not a legislator's not going to get involved. There's not going to be a patient advocate necessarily that's going to be able to make inroads there, because that IRB dictates the criteria and inclusion criteria. So that might be an option for you to ask if there's a way for you to have a conversation with the IRB, or to appeal to the IRB for inclusion in a study.
Thank you. Next, how can I get involved in advocacy initiatives related to rare diseases?
Oh, I'm so glad you asked that question. So NORD has a dedicated community engagement team, and there are a number of opportunities for volunteers from our Rare Action Network, which gets involved with policy and advocacy initiatives really on the state level, to volunteers who want to do a health fair or educate
Mm.
at schools, stuff envelopes. We really do have a variety of opportunities available for volunteers. And so what I would encourage you to reach out to NORD through the website, rarediseases.org, and it has a spot for get involved. It'll direct you to our community engagement team. They'll be in touch, and then you and they can coordinate as to what is your ideal volunteer opportunity, what's available, and we'll help to try and get that all arranged.
Excellent, thank you. I know NORD offers just so many resources, and I'm still learning about more and more. So this has been very helpful. Are you able to share any, and not specifics, obviously, but any time that you have helped a person with narcolepsy? Just what are the examples that maybe you could share, if you can think of any case studies?
I can think of a couple. NORD has a very robust patient assistance program for individuals who are diagnosed with narcolepsy. There is eligibility criteria. That is a confirmed diagnosis of narcolepsy. So, for example, if you have idiopathic hypersomnia or sleep apnea, you would not be eligible for that program. It has to be a diagnosis of narcolepsy. You have to be a U.S. citizen or permanent resident of 6 months or greater, and you have to meet financial eligibility criteria. Once those are met, you may be enrolled in the program. These are premium and copay assistance programs. So we help individuals to afford their health insurance. Every month, we're able to pay health insurance on an individual's behalf so that they can maintain that health insurance and access to care and treatment. I would say in the narcolepsy community, probably the number one need that I hear is copay assistance for prescription drugs and copay assistance for sleep studies and diagnostic studies that are being ordered by a clinician. We're able to provide that through our program to our eligible patients. Alicia, stories that you've heard?
Um, I would say along the lines of resources as it relates to disability benefits. We like the story that I shared that it was actually a narcolepsy patient who wanted to continue to work, but wanted to make sure that she was able to have a conversation with her employer as it related to accommodations. She was concerned about the fact that she's been taking a lot of time off, and she was actually concerned about the possibility of losing her job. So I encouraged her to, if she said, I asked if she had a good relationship with her immediate supervisor, that she felt comfortable enough to have the conversation, and she said she did. And so I provided the other resources necessary, which would be able to help her as far as finding out what the accommodations could be. So I sent her an email, and with those resources, she did respond back to say that it was helpful and she was thankful for the information.
Mhm.
I met a lovely woman actually just last weekend at the Living Rare, Living Stronger Patient and Family Forum. And among other diagnoses that she had, she did have a diagnosis of narcolepsy. And I was really grateful to hear that her employer made certain accommodations for her so that she could continue to work. She had been finding it very, very challenging, and she was able to discuss what her specific accommodations were, what her specific needs were, and they
Mm.
were able to adjust her schedule accordingly, um, to accommodate this particular need. And sometimes that's really what you need to do, is to identify what it is that you need that will make it possible for you to continue to work. Is the accommodation that instead of a 1 hour lunch, you have a 2 hour lunch? Or what is the specific accommodation that you need? Do you need to be able to work remotely? Um, do you need transportation assistance? What is it that you need that will allow you to continue to work? And talk with your employer, because the better able you are to articulate what the specific need is, the more likely you are to get that accommodation.
And
Thank
even
you.
maybe, I was
Go
just
ahead,
going to say, and
Alicia.
even in doing that, maybe even just writing a list, so just so that you have an idea of what are the things that you may need in order to continue to work. Prepare yourself in having that conversation is also, I would encourage that too. Just don't go in there and say you need accommodations. Maybe, like Jill said, think about what it is that would make working much, easier for you during this time. So
Follow-up question to that. People with narcolepsy many times don't want to reveal that they have narcolepsy and might struggle and try to continue to do their job, but could do a much better job and produce much higher quality work if they could only get their accommodations. What advice would you give to someone who's terrified to talk to their boss about accommodations that they might need or to review? Yeah.
It's a really good question. And I would say that if you don't have a relationship with your boss where you're comfortable to have that conversation, that's a role for HR, because perhaps there is family medical leave in the state where you reside, and that may be a way to access the accommodation. So there are different things that can be done, but again, it's going to be dependent on what it is specifically that you're seeking. And so the clearer you are in terms of what your needs are, you can take that to HR. So that may be a more comfortable path than speaking to your immediate supervisor.
also too, one of the resources that will be shared, there is a toolkit on that as well, and just about how to talk to your employer about work accommodations. And so that will be shared too on the resource list.
Oh, good. Thank you. Oftentimes we hear that depending on where the person is located in the United States, they have difficulty finding a healthcare provider that that is knowledgeable or expert on narcolepsy. And it's difficult for us to direct them other than, some doctors that might be in their area. I don't know if you have any other advice, um, to find somebody that can actually help in their area.
What I would recommend is the NORD Rare Disease Centers of Excellence. Again, they're throughout the United States. So what
Okay.
I would advocate for is find the one that's actually closest to you. Depending on your insurance, stay within your state. I know you might live on the Texas-Oklahoma border, and Texas might be closer than somebody in Oklahoma, but try to stay within your state. Again, insurance dependent, but look at the centers of excellence. Reach out to them. You may be able to make an appointment with them. If that's not going to be covered by your insurance and that's a concern for you, see if they can make a referral for you. One of the things that we've tried to do with our centers of excellence is really look at it sort of as a hub and spoke model. So there are 40 centers of excellence throughout the United States, but you still might need to travel a considerable distance to access one of them. What we're trying to do is really avail ourselves of their spokes and the folks that they have relationships with. So if your physician is not an expert in managing narcolepsy, he or she may be able to consult with someone at one of the rare disease centers of excellence, get
Mm,
information, develop a care plan that can be monitored and managed locally.
excellent. That's excellent information. Thank you. Any final questions while we have these very knowledgeable and experienced people here from NORD? I've learned a lot today.
Well, good. I'm glad. While
Yeah.
you're waiting for those last questions, let me again suggest take a look at the NORD website, rarediseases.org. There is so much information. Some of it is as I said, rare disease reports, and it may be more technical, although they are very readable. Some of them are blog posts. Some of them are resources you might never have thought of. And so take a look around. If you've got questions, if you need assistance, if you can't navigate something, we're here. So please don't hesitate to reach out to us. In the resources, we'll include information about how to contact NORD. We did have it on the slide, so if you didn't badly jot that down, don't worry about it. It's on the website, and we will share that in our resources.
That's great. I don't know, Alicia, if you'd be able to just share your website now and just show us a quick little navigation since we have a couple of minutes left. That might be helpful for people to actually see that. I don't know if you have that up.
I can do that.
Oh, okay, great. Thanks,
Sure.
Jill.
Give me 1 second. All right. Are you able to see my screen?
Yes.
Excellent. So if you don't want to just scroll around and see what's here, and the what's here right on the front page, you can see patient assistance, our rare disease database, information about our centers of excellence, and our I Am Rare registry program. If you're looking for something specific, you can go right up here to the little search bar. And let's type in narcolepsy and see what we get. Oh, we get lots of stuff. So we get some news about the Narcolepsy Network. We have the Rare Disease Report for Narcolepsy, Center for Narcolepsy Sleep and Health Research, our Patient Assistance Program. You may remember I mentioned that we have a premium and copay assistance program. There's continuing medical education here, the Narcolepsy Network, rare disease video on narcolepsy. I've found that students really like that. Somebody's a high school student and they're trying to explain to their friends, I have this rare disease nobody's ever heard of. These videos sometimes can be very, very helpful. Sometimes we'll have a clinical trial that may be related to narcolepsy that we've posted on here. We've got Wake Up Narcolepsy. We have the GUARD Rare Disease Report on narcolepsy. So you can see there's quite a lot here. There's news, there's blog posts, there's a lot going on. And so you can go to these different spots and click on it. And there's a video about narcolepsy that talks about the diagnosis. There's all kinds of information. So that's really disease specific. But we also have a resource library. Let's see if it'll let me go. There you go. Our rare disease resource library that talks about the Inflation Reduction Act. Anyone who's on Medicare may be hearing about the Inflation Reduction Act these days. So there's some information about that available. How to raise $500 in 10 days. Anybody want to do some fundraising? Email templates, guide to fundraising, information about rare disease advisory councils. We have information about research. We talked about, we had the question about getting involved. There's that Get Involved tab over here. How to make a difference. There's Running for Rare, participating in Rare Disease Day, school events. There's so much stuff here. You could spend quite a bit of time, and there are really compelling stories. Beyond your own story, sometimes it's nice to know about someone else's story and what they're going through. We have the ability for you to share your story here. You can click on that, and there's an invitation for you to share your story with the rare disease community. There's quite a lot going on. Rare disease news. I could spend half an hour here, but I won't in case there are any other questions.
Actually, one more question. That's really informative. Thank you. I have been on your site many, many times, and I'm going to go back and kind of after this presentation. It's nice to actually know kind of what I'm looking for. Are there any programs that provide financial support while waiting for an application for disability to be processed and determined? For example, advice or help programs that provide assistance for utility bills and that type of stuff.
Yes, and so going back to what Jill was saying, or just what I was saying too, let's just say that there is someone who is calling in and waiting for that information. So my team, the Information and Resource Services team, that's the kind of work that we do. So if it is that you may be waiting for your disability benefits, but of course, bills don't stop, right? So we are able to look at other resources that may be able to assist in the interim.
And some of those are state specific, some of those are county specific. So again, it's not a flat answer, but we can help you to locate them.
Wonderful resources provided by NOR. We're so grateful for your help and assistance. Any final, one more question coming in, I think here. I think that was the one. Okay. Any final questions before we end the webinar? No.
Well,
Well,
what I would like,
yeah.
I would like to say, we are delighted to be, your partner in this family.
Mhm.
No one wants to join. Nobody wanted to join the rare disease community or this rare disease family, but we are here for you. We're here to provide support, information, resources in whatever way that we can. And sometimes you're going to identify something that we don't have a resource for. We'll help you to go look for one. Or maybe there's an opportunity for NORD to develop something. So this is a partnership. We're in this together.
Thank you, Jill and Alicia from NORD. Excellent. I'm just so thrilled that you were able to join us today and share all about what your organization offers. I'd also like to thank our sponsors for enabling Wake Up Narcolepsy to bring this specific webinar and all of them to the community. Thank you to Avadel Pharmaceuticals, Harmony Biosciences, Jazz Pharmaceuticals, Centessa Pharmaceuticals, and Takeda Pharmaceuticals. A very informative session today about access to care and patient assistance for people with narcolepsy. So I think we'll be directing a lot of people who come to us with these specific questions to you more now, I think, now that I've increased my knowledge. And so thank you for the wonderful work you do. And thank you so much for joining us today in the community.